my name is Karla Salnoris.
My name is Katie Schaub, and we're both third-year pharmacy students.
Today, we will be discussing our research on the addition of phenobarbital to MINDS protocol treatment in patients with a diagnosis of alcohol withdrawal syndrome, or AWS, in the ICU setting, a retrospective chart review. This is a screenshot of our poster, and throughout this presentation, we will be discussing each individual section.
To start off, we'll take a look at the background. Alcohol works in the body by increasing the effect that GABA has on GABA-A receptors. In chronic users of alcohol, sudden cessation of alcohol will cause decreased effects of inhibitory GABA, leading to overexcitation of the CNS, which causes symptoms seen in AWS. Both benzodiazepines and barbiturates enhance the effect of GABA and CNS depression when GABA binds, which is similar to alcohol and why these classes are beneficial in AWS treatment. Some scales that can be used include CIWA and MINDS, which is used to help identify severity of withdrawal and help to guide treatment. There are many studies that investigate the use of phenobarbital in CIWA, but none for the MINDS protocol, leaving a huge literature gap, making this research crucial. The purpose of this study is to determine if the addition of phenobarbital in the MINDS protocol demonstrates a clinical benefit in AWS compared to those who do not receive phenobarbital.
This is a retrospective chart review that will be performed from January of 2018 to January of 2021 at Winchester Medical Center and has been IRB approved through Winchester Medical Center as well as Shenandoah University. Data will be collected through the EPIC software where patient charts will be reviewed, and the patients will be categorized based on their MINDS protocol treatment, which will be phenobarbital versus non-phenobarbital grouping. The primary endpoints will be analyzed as continuous data using an unpaired t-test, and secondary endpoints will be analyzed using chi-squared for categorical data and unpaired t-tests for continuous data. And inclusion criteria of the study include patients over the age of 18 years old that were treated in the ICU with the MINDS protocol for alcohol withdrawal syndrome. Each admission will be treated as a separate data point. Exclusion criteria includes patients under the age of 18 years old, a history of diagnosed cognitive impairment prior to admission with AWS, and current incarceration, and also pregnancy.
The primary objective is to determine if the use of phenobarbital within the MINDS protocol affects the length of stay in the ICU. The primary outcome is the median ICU length of stay in hours in each cohort. The secondary objectives and outcomes are split into 3 different groups, including admissions, medication use, and miscellaneous.
The admission group includes the overall length of stay in the hospital, readmission rates, causes for admission, and the primary location of the patients prior to their ICU admission. The medication use group includes benzodiazepines and the ones that were most commonly used, and phenobarbital use, including loading doses, maintenance doses, total dosing, which includes loading dose plus the maintenance dose, and the total days of phenobarbital utilization. And the miscellaneous group will be looking at the need and duration of mechanical ventilation, adjunctive medications and which ones were utilized, any secondary complications that arose and what those complications were, and an assessment of RASS scores to look at sedation.
Limitations: there is a potential for poor and inconsistent documentation within the charts. Also, since this is a retrospective analysis, decisions are made on behalf of the provider's discretion. In addition, there is potential inconsistency in phenobarbital use and dosages. Patients' length of stay may have been affected by other factors that are not able to be analyzed in this study, and data can only be collected for 3 years due to the MINDS incorporation in 2018 at Winchester Medical Center. Here are our references.
Thank you for tuning into our presentation. And if you have any questions, please feel free to contact myself, Katie, Dr. Woods Morgan, or Dr. Lewis Wolfson. And again, thank you.